And this is our signature show. It's called Powerpreneur, where we bring awesome entrepreneurs who have worked really hard on reinventing themselves, and they are here to show a way and give the strength to the community that entrepreneurship is, after all, worth it.
I like that. It is true that it's a very hard, difficult journey. But I think when you network with other entrepreneurs, they show you that it's possible.
Yes, it's also sometimes just the strength, right? Like we feed off each other. Like, okay, if she can do it, I can do it. I just have to stay focused. Sometimes that's all it needs. And that's why having that entrepreneurial friendships that are serving you in some or other fashion, in lifting you up, is really important, because you don't get that from your uh like colleagues that are in corporate, because they have a different mindset. Like, I respect that mindset, nothing wrong with it, but it's a tough journey when you select to be a trailblazer in the marketplace.
Yes, completely agree. It is definitely have to put on a different hat than when I was working in the hospital for sure.
So
Well, then
Jena looks pretty and her
let's
skin's
go ahead and start
glowing.
diving in.
Love it. How do you do all that? Like with the babies, the business, self-care? What are you doing? Tell us.
Oh, good God. Well, you caught me on a rough day, which is, it
This
comes
is
in.
how you look on rough day. How do you look on a good day?
This is done 5 minutes beforehand, but my 9-month-old has a ear infection, and then my 3-year-old has pneumonia and an ear infection. So I just got back from the doctor's office. But that being said, that just highlights the awesomeness of being an entrepreneur, because I was able
Right.
to press pause. I didn't have any meetings until now. So I woke up at 8:30, took him to the doctor's, which actually I can have a launch into a whole pharmacy story about how upset I am at the autonomy of New Jersey pharmacists. But I went to the physicians, and they're so swamped. The pediatric and pediatricians are actually pushing for the CDC to actually call a state of emergency. So whereas during COVID, everyone was like, state of emergency, the pediatrics, unless they had risk factors, specifically, like I saw a lot of diabetics get really sick in the pediatric field. But outside of that, we didn't feel it as much as now what we're feeling with the RSV, the flu, the COVID, the triple pandemic, and then the kids are going in. So it was just it. They were slammed. It took us like 2.5 hours from start to finish. And then I'm sure you guys are all well in tune with the antibiotic shortages. Um,
Yes.
so then we go to pick up the Augmentin and the Ceftonir. The Ceftonir they didn't have in the same concentration. And in New Jersey, they're not allowed to substitute, which is insane. So it just, I could
What?
go on a rampage of the lack of autonomy in New Jersey. But I had to then call the pediatrician back to get a new script for the same drug at a different concentration, which is so stupid. So so
Wow.
all that took me 4 hours. But that being said, it's because we work for ourselves. I'll just work more tonight, which is totally fine. Um,
Absolutely.
That's the perk, right? Like we all have noticed that. Like me with my health journey, McCoy with her toddler, and you with your babies in different age. Like entrepreneurship has given us that leverage that our job would have never. Especially, like, I was talking to a pharmacist yesterday, and this person has been manager with CVS, and his colleagues were like, hey, if you're wanting to start a family, make sure you do it irrespective of your schedule, because they will make sure you don't have babies.
yeah, it's so true, because I've seen both extremes, right? So like being full time at the hospital, where it was this like my first child was when they didn't even have the portable pumps. So I'm like a big breastfeed advocate. So with my first, there was times where I would just like pull the pump off if there was a pediatric code, pull the pump off, leave my milk there, and then run to the code and then come back. And I didn't have, if she was done, her feed in the morning, whether or not she was done, mom had to leave, because if I clocked in 1 minute late, I got written up, because that's the reality of working, a 7:30
we all know that.
to 4:30 job, right?
5-minute window.
Oh yeah, we
God,
didn't
I
even
was
have
just
that.
stressing out in the traffic. I'll be like, I want to run over all these cars and get to work because I don't want to get written up.
Yeah, and I was always like the a-hole. I'm from Jersey, so I'll try to keep my curses minimum. But that always would show up with like my Dunkin', because like I just couldn't survive. So I'd be late with Dunkin' Donuts, and like that's awesome. Like your boss loves that when you
Right.
Oh boy.
But when it comes to
we had to do, right?
So, but then my second, at least I was part-time and I had a portable pump. So that gave me a lot of autonomy. And then this one, it's fabulous because I've only had a pump like a handful of times for my little 9-month-old. And that alone, it makes a huge difference in your quality of life too. And just bonding with your child. And, there's so many times she's napping and I'm working. And so it's just beautiful. As hard as it is, just the perfect story of today, like the flexibility alone is worth it if you can just grind it out at other various odd hours.
I have to say, I can definitely relate to that. Like, thank goodness for entrepreneurship and even the ability to work remotely. There have been countless meetings that I've had, and no one even knew I was breastfeeding because, with the way that Zoom is set up, you can get this, the small square, and I would stand up while I'm just breastfeeding. And then I would have his little table to the side so that once he fell asleep, I could literally just slide him to the side without even leaving the screen. And nobody would even know. So yeah,
you guys are superhuman, man.
I've done that too. Big meetings with like male CEOs. I'm like, don't make a noise. But you have to. You got to do what you got to do. So thank God for Zoom, because they can't see anything.
Right.
It's like I'm wearing my pajamas right now, and it doesn't matter.
Yeah. It's so true.
Let's kind of go back in time a little bit. So please tell us, who is Dr. Quinn? Like, tell us, about, how you grew up and what really led you into pharmacy before we even go into perfecting peds.
Sure. So my name's Dr. Jena Quinn. I never do the doctor, even though I should. But
for our audience, we want them to know that you did earn your doctorate degree.
I did. I know. And then that like ravels into the whole Dr. Quinn medicine woman joke that I hear umpteen times a day. If you ever saw that show. So I honestly I wasn't of the generation of that show, but all my attendings would always, so I was like, all right, I gotta watch at least like one or two of these shows, because it was such a frequent thing that was said in the hospital. But what led in first child, how like parents, like once your profession, because you
Did I lose you guys?
I'm still here. I was wondering if it was my computer, but I think now it's Jena's because we don't see her at all.
Right. So we will wait till she's back. But what an awesome show, right? McCoy,
Yes.
We get to bring out the best of these people who are high-level entrepreneurs, such go-getters. I think her internet is giving issues, but at least we have each other to talk while things are getting resolved. So what is your take on this whole entrepreneur journey with being a mom? Because it's not easy. And you guys
it is not.
You guys are super.
No, it is not. Literally, she was just talking about how she went to the doctor's office and did so many things right before this meeting. I too was doing so many different things, making sure my son had lunch, while putting on my lipstick and making sure he had
Wow,
toys.
putting on your lipstick. Wow.
So that I could be presentable for the camera, right?
I can't wrap my head around this.
It is like literally, you know how they say with Spider-Man, your spidey senses are tingling. Like once you become a mom, you literally have like mom senses. And like I can remember like there's this one time right before he started actually crawling, and I had to like prepare for a meeting. He was on the bed and he was like pushing himself, and I was like literally on the other side of the bed and he was close to the other side. And so literally my mommy senses kind of went off, and it was like he's about to jump off the bed. I literally dove across the bed and grabbed his diaper with one hand from being on the other side of the bed, even with space between me and the bed. And I saved him, and I was like, I hope this diaper does not break. And it did not. And I was able to pull him back up onto the bed. But when I tell you that when you become a mom, like literally the superpowers just kind of happen and come, it does.
I did like 4 or 5 meetings for business this morning. And for me, that's like a lot already. So I'm like, I don't know how you guys do the meeting, the doctor's visit, the kid, managing their food and your own food. Like when you guys eat yourself, like
yeah, it's a lot of multitasking. And just even with me being on my wellness journey, as I do my own wellness coaching with my clients and things like that. And I've been, we're lifetime learners. So I've been learning so much as I coach my clients as well. And for example, you want to sit down and really take your time to eat. And that really allows that parasympathetic system to really go into rest and digest. But when you're doing multiple things at a time while you're eating, for example, your body's not able to fully rest and digest like it's supposed to. So it does come with its consequences. And unfortunately, even people without children, they do tend to balance multiple hats and multitask. And they're not able to just fully sit down and eat, just, as a random example here. But it really is important to be mindful of those things and try to find that balance.
So sorry.
So let's
no present for our internet to go off. Now I'm on my phone. Can you hear me okay?
Yes, we can hear you okay.
So sorry. But I think I got cut off when I was just saying that I was the one of 3, so I was the first. And my grandfather actually was a pharmacist. He was 100% my idol, and he passed away a little bit over a year ago. He is such a smart man. He actually has over 150 patents. And has also, on top of it, written multiple organic chemistry books, which was my least favorite subject in pharmacy school. But he was the reason why I became a pharmacist. My mom's a nurse, and he was a pharmacist. And so, growing up and seeing how successful he was in the pharmacy world, my mom was like, "You should try this." And then I kind of boiled it down to peds, even probably right around when I was already applying to pharmacy, because I grew up and have a sister that has epilepsy, and just seeing her throughout the years being ill, struggling, needing meds. There's a 10-year age gap, so needing to actually administer her diastat a lot, and that's what boiled down to. And ironically, now my biggest patient population is pediatrics who have epilepsy and autism. So I figured out pretty young that from just the help of my grandfather and my sister that I wanted to do pediatric pharmacy. And it was a long journey, but 120% worth it.
Wow, that is so amazing. So what does Perfecting Peds do, and what are you really looking for this year for Perfecting Peds?
Yeah, so right now, like when I started, I just had the simple vision of working in the hospital for 11 years, I would see these kids come in, and I realized time and time again that a lot of their home medications were incorrect. So whether that was, they were misdosed, they were the wrong route. Like a lot of providers forget, if you're putting medications down the J tube, a lot of them don't absorb. That there was polypharmacy. And I would notice, like, specifically in the behavioral psych and neuro patients, really anyone that had, more than 5 or more meds, that the chances of them having that medication error grew substantially. When I started just doing some deep dives locally, like who's looking at our kids in long-term care, acute care, who is looking at home care, that's another huge avenue. That really lacks clinical pharmacist oversight. They have a dispensing pharmacy, but those clinical services do not come with it. And then just like complex kids in general, I found out that, really it's just the pediatrician who focuses in on just like the primary care stuff, but then they have all these multiple subspecialists, and sometimes it's like 7 subspecialists that are all doing their own things, and the primary care doctor doesn't want to touch what the subspecialists are doing. And outside of that, they had, luckily a lot of patients go to the same pharmacy, but that dispensing pharmacist at a retail store doesn't have the training or quite frankly, even more so the time to deal with these complex, even if it's like simple pediatric cases. And so I just saw such a need of pediatric trained pharmacists that were in the community, where we traditionally only are in hospital or academia. In the US, I've only been able to find a few big children's hospitals that have them positioned in ambulatory care spaces. But I would say 99% of the time, if you have a pediatric clinical or pharmacist, they are in, academia and hospital, and then it's kind of like dead there. And then I also saw, quite frankly, I was really burnt out from seeing the patients really acutely when they were dying. It became really hard for me with multiple children, and I didn't really appreciate it till I stepped away from it, how much I would be re-traumatized. And, I kind of heal from seeing it and then be re-traumatized. And so I was looking for a way, honestly, to get away from the children in that really acute, sad setting, but still service them, because I love the pediatric patients. And so I started Perfecting Peds, and what I've been able to do in the past, really from birth to my LLC to now, it's been roughly a year. I have 5 local facilities that I service, me and my team. Thank you. But we serviced and we've done CMM on these patients. Almost all, I'd say, are medically complex in the way they have greater or 2 chronic disease states, or greater than or equal to 5 meds on a continuous basis. And so we've done it. Now we have all the data, and we're just doing the IRB approvals in, and now we're really just collecting the data to publish this. And so my long-winded answer of what Perfecting Peds wants to do is really span globally, because every state needs a clinical pediatric pharmacist really helping, the patients. But also what I'm realizing is that providers are, like I was saying before we got cut off, that the providers are asking for it to be a state of emergency in pediatrics, and the providers are burnt out, and they need help navigating these drug shortages. They need help, for antibiotic stewardship. And so really taking the role that we have so well established in the hospital for a pediatric clinical pharmacist that has all this massive autonomy, and getting us out to the community in various settings. And per state, that looks very different. Like for New Jersey, we need to enter collaborative practice agreements to be able to bill. And it's a lot more barriers than I had intended. Not impossible, just a lot of barriers. And then, to scale that actually on a national level is my dream and my 5-year goal, to kind of state by state get these pediatric services implemented, and then have all these children have, just like you have a pediatrician, you have a pediatric pharmacist that you're partnered with as well.
Wow. Powerful. You have definitely picked one of the hardest states though.
I didn't.
Yeah.
Until
New
I
Jersey and
started.
New York are very hard to get these. If you were on this side, way more than California would love this. All in support of it. So functional medicine testing is banned in New Jersey and New York. So I can't even order them for my patients. Like they don't allow PharmDs to do it, but I can do it in any other state. So that tells you a lot.
That does actually.
I can't order anything for my New Jersey, New York patients.
It's crazy. I do find that and I posted ironically yesterday, but I just started in the voices of the National or New Jersey Pharmacists Association and the New Jersey Board of Pharmacy, because like I said, I come from a very naive place where my past 2 hospitals, I've built this pediatric clinical patient care role is what it's called. And through then and over the years, I've gotten so close with my providers that they would be like, why are you calling me? Just change it. Or they'd answer the phone and be like, what did I do? Just change it. You get that autonomy of you can, if they give you a diagnosis, you could pick the drug, dose it, make sure it's the right route. All
it. But the laws don't allow you.
Right. And so I did in the hospital, not knowing that because I would get verbals from doctors all the time. And we actually had a lot of policies and procedures in place where we could change routes. We could weight adjust meds. We can do all these things. And then today, stopping at CVS and asking the pharmacist, can't you just change the concentration? She looked at me like I was crazy.
We can do that in California without phone calls.
Right. And but now with the drug shortages, that's even more so, because if we can't, then we need to have, clinical pharmacists in place that can do the antibiotic stewardship to make sure we're getting creative. Today, if they didn't have it, is there any way we could, use a capsule and open it up, or split a tab and crush it? You have to get creative with these pediatric patients, because if, it was amoxicillin and you had to broaden therapy unnecessarily to ceftonir, that's breeding antibiotic resistance that, could be, we know will be fatal for all of us, because of these shortages. Even something as simple as Tylenol has been on a shortage here. And so, the retail pharmacists they're amazing, but they might not know, because they all have amazing knowledge, but they may not have the time to be able to, ask for the weight, dose it. Then, oh no, we don't have liquid. All right, let's do a tablet. Let's split it. Let's, they might not have the time and the bandwidth to help these parents who are in a really scary situation, when not only can you not get an antibiotic for your kid because the retail pharmacist doesn't have the bandwidth to call surrounding pharmacies and obtain it, and they're not going to get it till tomorrow. But also then they can't even get an antipyretic like Tylenol because of the shortages too. So it's a really scary time. And I think it just stresses the need for us to start just expanding roles in general.
It's amazing what pharmacists can do, and I certainly commend you for all that you have done. So let's just kind of talk to another piece of what you kind of do. Let's kind of talk to a PGX, the pharmacogenomics piece, for some of our listeners out there that, pharmacists are really taking the reins and doing a lot more, really up to the things that we've been educated to do and even beyond that. So please speak to PGX, please.
Yeah, so I do CM for all of our for me, like the bare minimum for any patient is comprehensive. So we do comprehensive med management and just make sure like soup to bolts, everything looks great. Like we have, like I said, the right route, the dose. Is the drug needed? We deprescribe a ton, and you can use PGX to deprescribe, right? You might identify on PGX that the medication's not doing anything. Or it's actually, the patient's ADRs could have been anticipated with the PGX test, but I didn't really speak to. So that's part of what I offer. It's nice because a lot of my patients, being a little bit more complex, fall under the Medicaid realm. And that being said, they can actually get these tests for free. So it's just like a service that comes with the comprehensive med management.
That's pretty nice.
Yeah.
Mm-hmm.
Your patients are lucky.
They are
because
lucky.
other ones out there that are not getting that treatment in the fashion that they should be.
No.
So we wish you lots and lots of patience, because that's what we want for our country, is to have amazing protocols for all these kids. This is the future of our country. These are little kids who are going to grow up and become the future. If we're not taking care of them, like, what are we doing? Like, why are we the superpower then? I don't get it. So yes, you need to grow nationwide and cover all states.
Thank you. Because I feel like we've done, like with Medicare, we've done a better job as pharmacists and just clinically and using PGX in this patient population. And now I'm really biased because not that I don't love old people. There's a lot of, between the elderly and the pediatrics, there's a lot of things, and they're actually very similar.
Yes.
But my thing is that we've done such good jobs taking care of these geriatrics, or in comparison, I know we still have a lot of room to grow, but we're doing PGX tests and MTM and CMM on these geriatric patients, but we have these kids that need it just as much, and their longevity is so much more. And unfortunately, I hate it, but I'm starting to play the game of, reimbursements and finances. And if you want to put your cash somewhere or minimize spendings, you should do it with the kids that have 70, 80 years left in them. Then, so that's where, like, and just in general, you know what I mean? Like, I'm like, well, why don't, because you kind of have to play this game of this finance game to kind of stay alive in the business world. I'm realizing, which is not my passion, clinical care is. But yes, to your statement, PGX isn't as well published and studied in pediatrics as it is in the older population. But CPIC recently has now a whole section in it that is dedicated to pediatrics. Another field that is like similar and linear is I do take a lot of private pay maternal health patients. So like those high risk fetal maternal patients. We don't know if your PGX changes slightly, those tests, when you take it pregnant, but if there's a way like postpartum or before to get it, that would be ideal. But even if they need mental health services postpartum, again, I use that PGX test to kind of to take out the trial and error. So where I see it really already providing a lot of clinical utility in pediatrics is I've had a lot of success with behavioral health and psych meds for kids who have like failed numerous meds. And then it's like, oh, let's put them on meds that work. And then I had one.
Why is it such a hard concept to wrap around? Like telling you exactly like what is working, what's not working?
I don't know.
We can't apply common sense is what is happening.
Right, exactly. And then, and I've had like crazy, insane stories from behavior from like parents not even be able to get like the kid to go to school. Then in school, they're getting all this.
I wonder if it's from the lobby of the manufacturers, because then now some drugs will constantly come up as not working, because we know from trial studies that they were approved in a fashion that they shouldn't have. Maybe, I don't know, but I have evaluated many studies where the active ingredient didn't make sense, but it still is a drug that we use, right? So there has to be something bigger than what we see in PGX not being mainstream.
Yeah. And like I said, in maternal health too, like I feel like that's even more like daunting and scarier. So you're trying to take care of like another little human, and then you don't have 6 weeks plus another 6 weeks, maybe plus or minus another 6 weeks to play around with your meds. Like if you have, you know, there's so many different postpartum symptoms: depression, anxiety, OCD, which I had, which is really scary, psychosis. So like you don't have time to like play around with what meds work and what's don't. And so that's like another beautiful way you
I
can
could
use.
break a family.
Yeah, it could. And so I think,
And I bet it happens a lot. Like how many marriages you see fall apart after childbirth?
I know. Yeah, because and then there's, we know 1 in 4 women have it, but I swear, because a lot of women don't talk about it, is that's probably at least like 2 and 4, 3 and 4, because your hormones fluctuate so much. But again, that trial and error is like detrimental, even more
Yeah.
so to mom who's trying to, take care of her family. So those are like times where I've used PGX, and like I said, it's beautiful when it's like a Medicaid patient because it's covered. If not, then unfortunately, like $200 or $300 on the patient. But I always stress that it's a lifetime report, and it will update as we have more literature. We'll have more meds on there. And so, we already have a ton for psych, oncology, neurology, cardiology, and it's just going to continue to grow. So I think not doing it is silly. And like already my own daughter, I realized that I already did her PGX test. And like through that, I realized like she doesn't metabolize folic acid well. And so, and she's also,
the MTHFR
yeah.
mutation.
Yeah.
Yep. And then she also, on top of it, she has like, she won't do well, which is what I've always been on, an SNRI. But from looking at that, I'm like, oh, well, that's good to know, because
Now you can supplement a methylated B vitamin to her.
Yep, exactly.
I
So
actually had a case where this young girl in pharmacy school, it was a case where a young girl was in an asylum for 45 days and she was deemed as schizophrenic. And she had heavy deficiency of B12. That was the result. I mean, that was the resolution on the case, but she was not schizophrenic, but she needed methylated form, and a very high dose is what she needed. So we can't do this to human race. It's not human.
yeah, and actually during my own personal story, during my last pregnancy, my heart rate, thank God for the Apple Watch, told me it was like 10 beats per minute above where it had usually been. And so I was like, this is weird. So then I like went down and I felt so anxious. Like I was like, what? Like I felt like, but I was super tired. It was like before 30-ish weeks where you really evaluate the woman for iron deficiency. Here, I advocated to get my test. My ferritin was less than 10. My hemoglobin had dropped by 4. That too prompted me. I said, yeah, I'm like, can you just, I have celiac. So I'm like, can you throw on B12 too? So in the interim, trying to get those tests and stuff, I had to go up on my Effexor because could not function. Like I was like, I felt like my heart. So here, after getting, 5 rounds of iron sucrose and vitamin B shots, I was like a new person, and I was able to come down a lot on my Effexor. And I was like, it was the first time in any of my pregnancies or really in my life where I was looking and fishing for those deficiencies. And I'm going to continue to come down on them because I feel so much better. But I was like, I wonder why, like, this was like just fixed, I want to say like 8-9 months ago. And so I've been slowly coming down on my meds, and I'm like, and it does make me change how I practice, because I do, like with kids that have autism, even nutrigenomics too, just trying to not only, yes, I can prescribe, like we can find the perfect med for your child, but why don't we also see if there's like different vitamin deficiencies, different, obviously PG. And then on top of it, like if it comes to that, really the diet piece too, because even in my own kids, there's a huge, so it really forced me to like step back and take a more holistic approach on the patient. Like, yes, like I'm still a pharmacist and I'm going to focus on, getting your child on the right med. But two, also, like I said, a lot of my job is deprescribing with kids changing, their organs, their needs changing, their weight changing so frequently, sometimes they just actually organically outgrow their meds. So if that's the case, then we got to see if we can take it off. So it definitely, I think we've come to the realization that like just picking or just putting the first line med per the guidelines per diagnosis isn't where it stops. Right?
Agreed. Yes. It's amazing how your pharmacy knowledge has even played a key role in how your health is and how you were able to make recommendations, for example, even with the vitamin B. It's just amazing. I'm so thankful for my knowledge as well. And just to kind of piggyback off the conversation, when I, just deal with my clients, drug-induced nutrient deficiencies is really big. Like even being on a statin, for example, being on metformin, those actually cause some vitamin mineral deficiencies. So absolutely, I commend you for everything. So I kind of want to just now go into another question here before we get ready to close the session here. But for those new entrepreneurial-minded pharmacists, since you are a pharmacist yourself, what kind of advice would you give or do you have for those that don't know where to start, or maybe scared or feel like I need another credential or another degree? What kind of advice do you have for those pharmacists kind of scared or timid to step out into the entrepreneurial space?
I think a couple things. Twofold is like you are not alone. So like for me, it was getting a business coach. So I think there's so many people around you that are like farther along in their journey that will be able to help you. So I think we forget that because we're like, oh my God, this is so isolating and scary. And for me, I had a business coach, her name's Jamie Welke. She's well known in pharmacy world, but she was what I really needed just to like help me. And we have so many like programs and stuff. But you don't need that, but even if it's like, your finances aren't permitting, there's so many people in the surrounding space. The pharmapreneurs, I'm realizing, is a bigger and bigger, there's not a ton of us, but there's enough of us so that you can reach out to know that you're not alone. And then I think too, don't overcomplicate things. So for me, it was like buying my LLC. And then I was like, oh, like, okay, that was an easy first step. And then it's like, all right, let me reach out to some lawyers in New Jersey to find out like what I can do in New Jersey. And it was like, oh, like if I have collaborative practice agreements, I can do a decent amount. And then it was, all right, well, why the hell not just reach out to some surrounding pediatricians and see if maybe there's a need. And so I think it gets scary when you think like it's like an all or nothing type thing, but I needed to build this on the side for 8-9 months in order to leave my full-time job. So, I'm realizing like even when I meet with a potential client to, us actually implementing everything, it takes a year. So, give yourself grace. And I feel like because we're all type A, we're all very impatient.
Yes.
So like I want it.
It's not easy. It's not easy. Being a type A, wanting things done now. Like now, my business partners, they call me Bella Awara. That means like I want everything now. Like why is this not happening now? It doesn't happen like that. You have to stretch your patience muscle so much.
You do it in motherhood.
I have never been more patient in my life, and entrepreneurship taught me that.
You have to, like, you have your vision of where you want to go, but be great, be like gracious to yourself on the timeline. And so I think knowing like twofold, knowing that others are doing it, and like for me, like the reason why I really love Jamie is because she's a mom of 4, and I'm like, oh, this woman can do it. Like I can totally do this. And so looking at people and not being jealous, looking at people and being like, oh, Brittany's a mom and totally do this, And so I think that was like the mindset of no jealousy, just like looking around and being inspired by people, and then knowing that this is going to take it's a long game. And so, I always think like, well, I could not waste my time, but think how fast 11 years went in the hospital. I'm 34, so I still have realistically probably 30 years of my career left. So what strides could I make in those 30 years to advance our pharmacy profession? And that's a lot, right? So it's all mindset. And
it's
so that
mindset,
professional
absolutely.
development comes in for sure.
What I've noticed, guys, if you would agree, is all the thriving entrepreneurs, they turn jealousy into inspiration, or they don't have it. Like, I don't feel jealous when I see McCoy thriving, Jena thriving, Wilkie thriving. Like, I'm like, wow, this is amazing. This is the proof.
It's motivation and inspiration.
It is.
Like, and how can I lift others, right? Like, how can I lift Jena? How can we bring her to bigger, better audience? Like, what can we do to get her more contracts? Like, I'm sure, like, in our network, there are people who could collaborate with you on watching this. So that's the whole purpose, is how do we support each other? And it doesn't always have to be what's in it for me, what money can I make? It doesn't work like that, right? Like, it's about the community that you're building, a trusted community, an inner circle that can trust each other and then refer each other, right? Like, when Pete's come to my mind, it's Jena, right? That's what I had mentioned before. Like, when Pete's come to my mind, it should be Jena. When nutrition and NGX come to your mind, it could be McCoy and Mansi, right? Like, who are doing the work and who you can trust to get advice from.
I agree. Yeah, no, and it is like well, first, it doesn't serve you. But second, like, I do think, karma. And so I think every person you help eventually, like, it doesn't matter. Like, even I have like my social media outside of LinkedIn is just really, I give like free pediatric pharmacy advice. And someone's like, you should make this whole insane, like, you have to profit off of it. And I'm like, I just want to help other moms. Like, and I do believe like karma. I'm like, it's going to, like, eventually it will pay off. But I really like, you just have like more of a servant attitude, and then like will work out.
And I think the person that made that comment, they're also missing a key important thing behind what you're doing. You're providing the value up front so that when somebody is ready to go into a more in-depth conversation with you, they already know that you provide quality work. So, there's an indirect way and a direct way to sales. And I think that is a mindset shift that person may need to consider.
Yes. And then honestly, I was in like multi-level marketing or sales for 3 years as a pharmacist. That allowed me to go part-time as a mom. And I know you and Mansi do a lot with sales too. And I think that was the best thing I ever did, was just because it like gave me all of those characteristics and attributes and really was uncomfortable. And what stretched me was me doing that. And I didn't learn any of pharmacy school. So my poor daughter is doing Girl Scouts, and I'm like, we're going to get out. And I have this big sales, like, I'm like talking her up. I'm like, you got this, girl. But like my mom, like, not that my mom was so like nursing and so medical. She never stretched. She never like taught me lessons like mindset. Like when we say like who we love every night, and in our prayers, my daughters always say, and I love myself the most. And I'm like, yeah, you do. Because you like those
That's right.
That
self-love is not conceited. It's the most beautiful love you can have.
So yeah.
No, you are such an amazing role model for the girls. I'm telling you, like, they're gonna come out as badass entrepreneurs, amazing humans, amazing moms in future. So that's what I love about these entrepreneur moms.
We need males in this space anyway.
Yeah, and I applaud your husband for being so supportive. A lot of women don't get that, and that's where they kind of fall short. like
Oh my
a
God.
lot of taunting, a lot of like, you're not bringing in the money. I mean, how are you going to bring in money in the first year of entrepreneurship? I don't know, unless you're like ripping people off and doing it the wrong way.
And a lot of it too to do it the right way, like, and he's been very patient. Like, I'm like, can I have another couple thousand for this or another, like, like, sure. Like,
I
he's
get
been
it. I get
patient.
it.
Yeah,
It's not easy, but he's supporting you and he knows you're working hard. You're giving everything you can. You're being there for the kids. I mean, what more can you do? What
You're
more
so
can you do?
sweet.
I don't know of anything more you can do
She's
on top
already
of what you're doing.
on it.
Oh no, so my husband's so supportive. He went out around here, like, if you donate plasma, you can get like a pretty penny. So the poor man's donating plasma to support the family.
That's amazing. Hey, he's doing whatever it takes, man.
Wow.
That's
But
what
the effort,
an
the thought
amazing
and the
man
effort,
does.
wow. So Jena, please let our audience
Thank
know where they can contact you, where they can find you, where they can look you up. Please share. I'm sure there's some people that would love to just kind of look you, maybe follow you, or even have a conversation with you.
Yeah, gladly. I love networking, and even like pharmacy students. I've actually met up with a lot of them recently, just because it is intriguing to do things a different way than they've bred us in school. But I'm on LinkedIn, Jena, one N, because my parents had to be different, so Jena, and then Quinn's with two N's, Quinn. I'm also on Instagram as just perfecting_peds. And then on Facebook too, everything's public. And I do have a Perfecting Peds page. And then my website as well, perfectingpeds.com. So any and all those ways you can contact me and my team. And it's been such a pleasure. Really genuinely appreciate your time and thinking of me to be on the show.
Absolutely. We'll bring you back, dear, with more and more success.
Oh,
And
absolutely.
tons of students who can collaborate with you and learn, and you could have an awesome team from that. So absolutely.
I have a couple of Rutgers students working with me, and they've been amazing.
That's awesome. Wow, such a trailblazer. I look forward to following up on your journey and being able to chime in and send you congratulations along your way.
Same to you, ladies. I appreciate it.
Awesome. All right. With that, I'm just going to post Jena's link on the show. That way people can get access to her, because when they're watching this, it's right there. And thank you so much for improvising, Jena, getting on your cell phone. It's such a bummer, right? When you have something scheduled, it's like you have this party to go to and your child decides to go sick, and then you have this show to do and your internet, like, I don't know. We are
Resiliency, amazing.
So I get it.
Thank you, ladies.
All right. Pleasure. Yes. Have a powerful week, all of you. And even for our audience who are listening,